when we're talking about any kind of disease, okay, and I mean corona, flu, whatever, your best defense for any disease is a good immune system. But is this appropriate today, or is this appropriate? Pray as though everything depends on God, but work as though everything depends on you. Absolutely. Now, what's going on with our society? It's nuts. Okay, now, we've had a number of videos censored. So when you get the video, download it. Don't just copy the URL. We're putting all our videos on BitChute, so get on there. And also you can go to Extreme Health Academy and get access there. So we will keep getting the information out. Now, when we look at this, are we designed to live on this planet? I mean, what kind of suits do we need to live here? Well, this is one of the comments that I got. I get all the data and facts, but we still need to quarantine so we don't bring it to our vulnerable. Do you want to be responsible for killing grandma? Yeah, tell him that. Okay, so when you look at this, and this is a very passionate person, and you've got these people wearing these masks. Now, we've done several, research articles on it, that they are not that effective. So what is this? Killing grandma, what's the actual death rate? Well, for one, this for Center for Evidence-Based Medicine, they say that the critical cases had a 49% rate of death. That's because they had all of these conditions. No deaths occurred among those with mild or even severe symptoms. No deaths. So let's look at the actual rate of death or the actual rate of survival. Is just being alive more dangerous than the coronavirus? Absolutely. So let's look at this. Case fatality rate. If you're less than 9, you have 100% life. And then look at this. 10 through 19, 99.9% chance that you're going to be okay. Look at 20 to 49, 99.7, 98.7. And as you get up there, even 70 to 79 years old, it's still 92%. Now, this is not everybody being affected. We're talking only the ones that were tested, only the ones that were sick enough to go to the hospital. And we know, we're talking minimum 85 to 92% of the people that get it don't even go to the hospital. It feels like a mild flu. The big challenge is down here, greater than 80. There's still a 15% death rate or 85% survival rate. So now, what do you want to do? Do you want to just quarantine everybody, shut down all the businesses, crash the economy? Or should we look at those vulnerable and take care of them? I'll tell you right now, let's just take care of the immune system. I got this on MedPage, and it's interesting because when you see stay at home, grim ethics, and National Guard alerted, absolutely. So what are the grim ethics? Well, for one, and this was as of Monday, 35,224 cases. Now, this is using a test that admittedly it has an 80% false positive rate. 471 deaths out of 329 million people. And that's going to cause our economy to crash. So you might ask yourself, are we going to kill grandma, or how many people actually die? Now, this rate here is for the last 3 months, not per day. So how many people actually die in America? Well, on average, around 7,700 people die. Now, you're not seeing this in the media. It's not coming across in the media. It's all the fear-based. So when do people generally die? In the wintertime, January, February, December, and that is every day, every day. Now, this was an article back in Lancet at January 31st. They said that it's going to peak and fall down, and this is happening around the world. We're looking at Netherlands, Germany, China, South Korea. Everyone is having that. So why are we crashing the world's economy and putting people under risk? How many suicides have increased? How many people with high blood pressure are stroking out? How much increased in anxiety, stress, depression? All from this? Now, this is what kills people. The 7,000 people a day, this is what's killing them in America. And we're looking at this thin film here of influenza, and it's not even that thick because that's influenza deaths and pneumonia. We're talking a minuscule amount. How come this isn't in the news? Ask yourself. Now, there has been a dramatic rise in high blood pressure rates, really, in America. Why would that be? Why should we be afraid of it? Well, from 2007 to 2017, you're looking at nearly a 30% increase in deaths from high blood pressure. And in fact, because what do we do in this country? If you have high blood pressure, we don't look for the physical, chemical, or emotional stress. We drug you. This University of Alabama says you're in much trouble by the time you're on 3 medications that achieve excellent controls when your hypertension is untreated. We want to raise the issue that despite great advances in a pharmaceutical approach, relying solely on this approach is going to come at a dear price of people's lives. Then we look at Dr. Orange. There's over 300 different medications, and what do we have? We have the most medicated population. You get people over 70, what are they doing? People in our country, the average person over 60 takes 12 different prescriptions. 300 medications are known to cause some type of lung disorder, and what are they? Blood pressure, cholesterol, anti-inflammatories, antacids. And what's the X-ray finding? Ground glass opacities. The exact same finding that you would find in a corona victim. So is it misdiagnosed? Well, let's look at this. Flu vaccine science. Okay, and this was out of the British Medical Journal. From 1968 to 2001, there was an increase in deaths as the flu shot increased. So you shoot more people with the flu shot, more people get sick and die. So this is causing an inflammatory response. No wonder it's affecting our seniors. So let's look at Italy, because what do people say? Well, look at Italy, look at Italy. Let's look at Italy. You go to healthdata.org, type in an Italian crude death, and you can see this hockey stick spike in death. And we can put this on the media and scare people, because that's what the media is for. Or we can say, hey, look, this is 2006. Since 2006, for the last 14 years, there's been a steady increase in death rates, okay, in Italy. Why? Maybe economically depressed, maybe poor nutrition. But wouldn't it make sense, instead of quarantining the entire planet, find those vulnerable and take care of them? This is a typical patient that we get. 69 years old, high blood pressure, indigestion, thyroid. Of course, he's medicated. If he is medicated, okay, if he is medicated, he has a 96% chance of survival. Okay, if he is, drugged, okay, or I should say if he's not medicated, he has a 96% chance of survival. If he has taken medications for those conditions, he will die early. But how about we just fix it? We correct the high blood pressure, you correct the physical, chemical, and emotional stress. So you don't have one of those conditions like type 2 diabetes, high blood pressure, high cholesterol, and drug the symptoms. You look for the underlying cause. What are the deaths in Italy? And we're seeing from 2007 to 2017, lung diseases have increased rapidly. And this is a virus. In fact, all viruses affect the lungs. You're looking at influenza. What is that associated with? Pneumonia. No wonder it was already rising. Then we look at America's deaths. So healthdata.org, United States, respiratory tract is number 6 there. So we have a very sick medicated population. But what is causing the most death and disability? You can see this line here and you're thinking, oh my God, that's it. That's what we got to be afraid of. No, that's drug use disorders. This is the opioid epidemic. This is induced by our medical system and the inability to take care of people. Let's look at lungs. When you breathe, the diaphragm comes down. That's breathing air in. The diaphragm comes up, breathing air out. So it moves up and down. Now, this is governed, the diaphragm, by C3-234 keeps you alive. So in the neck, those nerves, if that's supply the diaphragm, C3, C4, C5 keeps you alive. Now, that blood has to come in here and get that carbon dioxide oxygen transfer. If you have blood that looks like this, and this is a common stress response, this is what we see in our clinic in Tijuana. This is toxic. What do you want to do? You want to clean it up so you have better looking blood so it can go through the system. That is common. And if people have that, they're misdiagnosed with blood pressure, with everything else. Viruses are beneficial for asthma? Oh my God, don't we have that fear of viruses? Unless you read the British Medical Journal. Repeated viral infections other than lower respiratory tract in early life reduce the risk of developing asthma. Amazing. Antibiotic use, okay, in infancy associated with increased asthma. The association between antibiotic use in the first year and asthma. No kidding. What about cholesterol? Remember, we are the most drugged population the world has ever seen. Cholesterol is vital. It's vital for hormone production. You make every glucocorticosteroid, minocorticosteroid, sex hormone, everything. And if you take a drug to lower it, according to the expert review of clinical pharmacology, it increases hardening the arteries and heart failure. Cholesterol drugs, look at clinical cardiology, hurts the heart muscle, okay? Increased coronary plaques. So what weakens your immune system? Stress inappropriately dealt with, physical, chemical, and emotional. Medications, all medications. If you're taking a medication, find out why you're taking it, and either fire the doctor that gave it to you or talk to him and look for an alternative. Say, hey, doc, why do I have high blood pressure? He'll say, I don't know. Let's go to the chiropractor and check your nervous system. Yeah, that'll happen. Nutrient deficiencies, minerals. When you age, you produce less stomach acid. Less stomach acid means you can't absorb the minerals. Sedentary lifestyle, lack of sleep. That is what's weakening the immune system. That is what is affecting that small percentage of our population. The small percent that is actually getting sick and dying. I just read a report out of the United Kingdom. This health minister who said there's going to be millions of deaths, he now recounted and said there's probably going to be less than 20,000 in the UK. And he said most of those people would have died anyway in that year. The corona just helped them off because they were old, sick, not healthy. You know, that is what weakens the immune system. This is what strengthens your immune system. Healthy stress, that means exercise, work, breathing, working your body out, working your mind out, healthy sleep, active lifestyle, sufficient nutrients. This is what destroys you. Bottom line, get healthy. Get healthy, get your body back, look at your physical, chemical, and emotional stress. That's the key to surviving this. And if people come at you with fear, just say, hey, look, man, my DNA, 45% of my DNA is viral. You will be okay. This is Dr. John Bergman. God bless you. I love you.